Hello, my name is Abdussalam, and today we will talk about the cleft lip and the cleft palate. But before we talk about those important topics, we should understand how the lips and the palate develop. At first, the development of the lips. First, we will talk about the lower lip. The lower lip forms by the mandibular process, which is continuous, and join in the middle line. So, the lower lip is continuous. But in terms of the upper lip is formed from three parts. The philtrum is formed by the intermaxillary segment, and the two lateral parts are formed by the maxillary processes. After we talked about the development of the lip, now we want to explain how the palate develops. Here we have two palatine shelves from the maxillary processes that will form the secondary palate. In the beginning, the palatine shelves will be vertical and the tongue will be in between. At this stage, the tongue is huge. So, when the head elongates superior-inferiorly, the tongue depresses down. When the tongue goes down, the palatine shelves will be separated, but then they move towards each other to fuse and join and form the secondary palate. This process will end at about 10 weeks post-fertilization. We previously talked about the palate from the coronal section. Now let's look at the palate from another view. For the palate to form, three parts should fuse, which are two palatine shelves and the primary palate. The primary palate is formed by the intermaxillary segment. The two palatine shelves, which form the secondary palate, is formed by the two maxillary processes. Now we have an important area of fusion between those three parts, which is called the first point of fusion and happens in the area of incisive canal. From this point, another three areas of fusion arise. The first one between the two halves of the secondary palate. The second one between the secondary palate and the primary palate on the right side. The third and the last between the secondary palate and the primary palate on the left side. So, what happens if one of those structures fail to fuse? The cleft lip and the cleft palate will be the result. So after we talked about and explained the development of lips and palate, now we will talk about the cleft lip and the cleft palate. The cleft lip happens from the failure of a fusion between the intermaxillary segment and the maxillary processes. So not only the upper lip is affected, but also the primary palate. In terms of the cleft palate happens when there is failure of a fusion between the palatine shelves. It is considered that the mildest form of cleft is the bifid uvula. Now there are two types of the cleft lip, the unilateral cleft lip and the bilateral cleft lip. On the other hand, the types of the cleft palate are the hard and soft palate cleft and the cleft uvula, which is the bifid uvula. Now, the cleft lip and the cleft palate could happen together, which is the cleft lip and palate, and have two types, the unilateral and the bilateral. So, the result of the cleft lip and palate, it causes feeding problems to people, because the oral cavity will communicate with the nasal cavity. So each time the patient eats, the food goes to the nose. And the solution here is doing a surgery or appliances that act as a barrier between the mouth and the nose.